Thank you for joining us today. As we get closer to the one-year mark of our fight against COVID-19, more and more Idahoans are receiving the groundbreaking vaccine, and the end of the pandemic is in sight. Our goal with COVID-19 vaccine planning and distribution is, in part, to reduce transmission, preserve a functioning healthcare system, and get back to normal as quickly as possible. When it comes to the vaccine rollout, the government plays a role and the providers play a different role. The state of Idaho ensures providers receive the doses, and the providers ensure the shots get in the arms of people who want it. No doses are shipped or stored at the Idaho Department of Health and Welfare or any other state entity. All doses allocated to the state of Idaho are shipped directly from the manufacturer to the local public health districts and enrolled providers as soon as they are available. Over the past 45 days, more than 89,000 Idahoans have received at least one dose of COVID-19 vaccine. And I want to thank those healthcare workers, teachers, and others who have taken this important step to get us back to normal. We are working hard to ensure that COVID-19 vaccine is administered as quickly, fairly, and safely as possible. I increased the number of available National Guard personnel to assist in vaccine administration. And we recently rolled out new grants to ensure healthcare providers have no resource barriers to administering vaccine as quickly as possible. To ensure transparency in where vaccine doses have been given in each county, we have made a vaccine dashboard available at coronavirus.idaho.gov. But there is more we can do. There are questions about whether vaccine is being administered quickly enough after it arrives in communities across Idaho. And quite frankly, we need a clearer picture. To shine more light on vaccine administration and improve transparency about where the vaccine is available across Idaho, today I am signing a new executive order. It's called the Transparency in the Administration of COVID-19 Vaccine Executive Order. My executive order requires health districts and providers to regularly report the number of vaccine doses that have been allocated, how many shots have been given, and how many doses they have in inventory to ensure vaccine is getting out in a timely fashion. We will be able to see in practically real time the number of doses each provider has received, administered, and has in inventory to demonstrate our commitment of getting out doses as quickly as they come to Idaho. We owe it to Idahoans to get shots in the arms of people who want it within 7 days of doses coming into Idaho. If it appears a provider is not administering their allocated doses quickly enough, we will step in to ensure they speed things up. I will review this information daily to ensure that doses are distributed equitably across Idaho, and the providers and public health districts have the operations in place to be able to give shots within 7 days of the doses arriving. I am also actively working with our Idaho Public Health team to make all this information publicly available for Idahoans to view online by Monday, February 8th at coronavirus.idaho.gov. On February 1st, the 65 and older population can begin making appointments to receive vaccine in Idaho. This is a big step to keep our seniors safe and healthy. But I want to be clear, there is still a big gap between supply and demand at this point. The senior population in Idaho includes more than 265,000 people. Idaho currently receives just 24,000 first doses per week. Based on our current allocation, it could take 2 months for eligible people to receive their first dose. So I ask, please be patient. There are some providers in Idaho that are ready and willing to receive more doses of vaccine. I want to thank those providers across Idaho that have met the demand and stepped up to help their communities. When it comes to our anticipated supply, I want the people to know we are pressing the Biden administration to make sure Idaho receives more doses of vaccine as quickly as the supply chain can be ramped up. All these steps should give Idahoans confidence that we are actively addressing any challenges we have identified in getting the safe and effective COVID-19 vaccine administered in Idaho as quickly, transparently, and fairly as possible.